Welcome to this module on the trauma bag. This module is one in a series provided by Ellis & Associates, a world leader in education, training, and aquatic risk management. Let's begin this module by reviewing the components that are expected to be inside the trauma bag and the purpose of these items. Additional modules discuss each of the components in more detail.
The trauma bag needs to be checked frequently and must contain the emergency response equipment needed to aid a person experiencing sudden illness or injury. Those who are expected to use the trauma bag must understand what equipment is inside the bag, in which compartments items can be found, and where the bag will be located when it is needed in an emergency. Each trauma bag contains a personal protective equipment pack, commonly called a PPE pack. The equipment found in this PPE pack includes medical exam gloves, face mask, eye protection, and gown. These items are necessary to provide protection for those administering care when they arrive on the scene. The bag will also have a supplemental oxygen support system, commonly called SOS. This provides crucial equipment for anyone in respiratory distress. The SOS includes a full oxygen cylinder with a regulator properly attached to dispense the oxygen. Oxygen tubing is used to connect the regulator on one end to the oxygen delivery device at the other end. The oxygen delivery devices in the trauma bag are one of two types. Devices used for those who are not breathing include resuscitation masks with one-way valves and filters, and bag valve masks with filters. These come in different sizes for adults, children, and infants. Delivery devices used for persons who are still breathing include non-rebreathing masks. These come in adult and pediatric sizes. A pulse oximeter is used to help guide the use of supplemental oxygen. This device is attached to a person's finger to measure the oxygen level in the blood as well as determining the heart rate. The trauma bag will also contain a hand-powered suction device to help clear fluids such as water, saliva, blood, and vomit from a person's airway, and it should include a spare cartridge. An automated external defibrillator, commonly called an AED, is available for someone in cardiac arrest. The device is able to determine the heart's electrical activity and provide a shock if needed to try and restore a proper heartbeat. The flashing light on the device indicates the unit is functioning properly. An AED includes a ready kit. The kit includes scissors to aid in the removal of clothing, a drying cloth if the chest is wet, a razor to shave away excessive chest hair, alcohol pads, and medical exam gloves. First aid supplies such as rolls of gauze, gauze pads, and medical exam gloves are part of the first aid kit, which is included in the trauma bag. If your facility allows for the purchase and use of epinephrine for severe allergic reactions, or naloxone for suspected opioid overdose, these life-saving medications may be kept as part of your first aid supplies. The equipment in the trauma bag enables a responder to effectively provide care for those suffering from medical or trauma emergencies. Frequent training with the trauma bag and its equipment will make you more confident in your ability when faced with a real emergency.
Thanks for viewing this module on the trauma bag. We hope this has helped to make you more knowledgeable about the components included in the bag and how these components can contribute to a positive outcome for anyone in distress. If you have any questions about this presentation, please address these to your instructor or supervisor.